The days of conducting organ transplants and other complex surgeries without the requisite legal framework are likely to come to an end soon, with the introduction of the Human Organ and Tissue Transplant Bill, which was tabled to the National Assembly by Health Minister Dr. Frank Anthony on Thursday. During his presentation on the Human Organ and Tissue Transplantation Bill 2021, the minister informed that the legislation paves the way for Ghana to be able to conduct organ harvesting for therapeutic and research purposes. After the bill is passed, a national human organ and tissue transplant agency will be created for the management of the removal, donation, and transfer of human organs to people in need. The agency will be headed by a team including a chairperson who's appointed by the health minister, the chief executive officer, the chief medical officer, and the chairperson of the medical council. The agency will coordinate with hospitals which are permitted to conduct the transplant surgeries and collaborate to establish the operating procedures. The National Human Organ and Tissue Transplant Agency will be responsible for public education campaigns as well as providing information relating to granting consent for the donation and use of organs. Earlier this year, Dr. Anthony had indicated that this piece of legislation is necessary so that these procedures can be governed by rules on who can donate organs and who can receive. Head of the transplant team at the Georgetown Public Hospital Corporation, Dr. Kishore Prasad, said that the bill, once enacted, would allow for cadaveric donations to patients who are unable to acquire donors. He told reporters that the majority of the patients requiring transplantation at the time did not have donors.
So we have like over 150 patients that will be accessing dialysis through the length and breadth of this country. Out of that 150, you could calculate 75% of those patients are likely candidates or that are transplantable. Some of them have donor, but because of same testing like this, they cannot donate to them. And some of them do not have donor, which is a majority of them. So they cannot access a transplant.
Cadaveric transplant involves taking organs, heart, lungs, kidneys, liver, pancreas from dead people, as well as tissue donation. During the last 5 years, the Georgetown Public Hospital has been able to conduct in excess of 31 transplant surgeries. Tamika Rodney reporting for the HGB Nightly News.